Hey guys, Bella here. In this video, I'm going to be covering how you can apply for healthcare. We have begun open enrollment for November. It starts in November and I believe it goes through December 15th that you can apply for coverage on the Healthcare.gov website. I did successfully get coverage in 2021 and I really liked my insurance coverage for the year. This was my first year being off of my mom's insurance and having my own insurance, and I found that the rates were really affordable. My doctor's visits were about $40. My prescriptions were anywhere between $1 to $20, and my therapy visits were around $40. So I selected the Blue Cross Blue Shield Select Silver plan, I believe. But what we're going to do in this video is we're going to go through like how to apply with a new application. Basically every year you are going to have to come back and update your information in order to figure out what amount you're going to have to pay, and then most likely you're going to be receiving some assistance, because if you don't make a certain amount of money, you're going to get basically some help with your plan. So don't think that your plan is automatically going to cost $400 or $500 a month. It's very likely that you will be able to get some assistance. So let's just go ahead and start by beginning my application for 2022. On this page, you're going to find the details about your application. It's going to say fill out this application to check for two things: if you or others in your household can enroll in coverage, and if your household can save money on coverage costs. So that is what I'm going to be trying to figure out now, is if I can save money on my coverage cost. So you're going to set up your application. You're going to enter all your details about yourself, your household information. You're going to report your current coverage and your life changes. So if you change jobs, if you got laid off, if you got a raise, if you make less money now, if you had a baby, if you became disabled, anything like that is going to go in this particular section. And then you're going to submit your application, and that's going to take you to the page where you can select your plan. The first section of setup is pretty self-explanatory. It's just asking you questions like your address, your phone number, if you plan on submitting a 2022 federal income tax return, how you'd like to be contacted, whether or not you need coverage or more people in your household need coverage. So I have omitted that part of the video for my privacy, but basically it's a pretty self-explanatory thing that is just going to ask you a couple of questions that you have to answer about your household demographics and your personal information. This page is probably the most important page. This is going to ask you for your income and expenses. And since I am a small business owner, this is information that is going to come off of my tax return or the best estimate that I can provide. So that's just going to be all of my income less my expenses, and that would give me my profit, and that would be the amount that is considered my gross income. So what you're going to do is you're going to fill out this information. It's going to ask you how you got your money. So basically I have two major income streams. So that's what I'm going to be including on my income here. I've got my self-employment business number 1 and self-employment business number 2, and those are what I'm going to be using to come up with my income. So once you put in this monthly amount, it's going to basically calculate for you what your expected income would be for 2022. It's going to tell you that this is what they can expect based on estimates. It says not to worry if this isn't the exact total, they just need a close estimate. And if you are following what was going on in 2021, they actually did not make people pay the difference for how much they underestimated their income. So if they got cheaper rates for 2021, they did not wind up having to pay back the US government. So that is just something to keep in mind. You want to get a close estimate, but you don't want to overestimate. You don't want to be paying more than what you have to be paying. So based on that number, it's going to give you an expected yearly income for 2022, and it's going to ask you if they think that is correct, and then you're just going to save and continue there. So just make sure that you get the most accurate numbers that you can come up with, and make sure that you don't leave anything off of your income statement. But for me, I think it's better to estimate on the lower end. You're also able to deduct certain expenses. You're able to deduct your student loan interest, any alimony payments, and IRA contributions, educator expenses, and penalty on early withdrawal of savings. So if any of those apply to you, make sure that you get the correct information so that you can deduct. Any deduction that you have is going to result in you paying less for your monthly premiums. The next section is going to cover whether or not you already have healthcare benefits through a job, and since I am self-employed, that's going to be a no for me, but it could be different for you, and I'm sorry I don't have the exact information on what you can do, but most of this is pretty self-explanatory. They have oversimplified this website to make it super easy to use. And keep in mind that you can also use people, I believe there's some insurance agencies that can help you sign up for coverage. So if you are, having questions, definitely get on top of this and do this before the deadline. Try to get this done a couple weeks before the deadline. Again, it is December 15th, 2021 in order to have coverage for the 2022 year. Alright guys, based on the information that I put in my application, it says that I qualify for a premium tax credit of up to $396 per month for my household. So what that means is if I select a $400 plan, I will be paying $4 per month. If I selected a $600 plan, I'll be paying about $204 per month. So that gives you a little bit of an idea about what you may have to pay. So from that page, it's going to ask me to renew or change my 2022 coverage. So I can either keep the plan that I have right now, or I can upgrade or downgrade just based upon my needs. So what I'm going to do now is kind of take a look at all the plans that they are offering for the 2022 year and just kind of decide on what is best for me. And what is best for you is going to be determined on a lot of factors, but one of those is like, how often do you go to the doctor? Are you a person who goes to the doctor every other month? Do you have medical problems? Do you work like a dangerous job? Could you get hurt? Or do you have any recurring medical problems? Do you want to go to therapy? Are there chiropractors that you want to visit? These are all things that you can kind of factor in for your plan. And one of the things that I try to consider is, what's the worst case scenario? What possible thing could happen that would put me in a bad situation financially if I don't opt in for certain types of coverage? And obviously nobody wants to think about that, but the main reason that we're all applying for healthcare is so that we don't go bankrupt if we get into a major accident. If something happens that puts us out of commission and puts us in the hospital for several weeks or even several months, we don't want that to be a catastrophic event on our healthcare and on our bank account. So that's something that I would ask you to keep in consideration when you're selecting your plan. So let's just take a look at these plans and see what they're offering. There is one more page to look at, and it's going to ask you if you want to use all of your tax credit to lower your monthly premium. So you can use all of it or some of it. I'm going to be using all of it just based on what I know about my income. I don't think it's going to change that much, and I think that if I was liable to pay a little bit more, I don't think it would be very much, so I'm going to use this to my benefit. You can also use some of your tax credit each month. This says it's a good choice if your income in 2022 will be higher than your estimate, and then you can use none of your tax credit. Good choice if you don't want to risk having to pay money back on your federal taxes if anything changes. Personally, I don't think that's a very good option. I'm going to be using all of my tax credit so that I can save as much money as possible, and if I need to reconcile later and pay back a little bit of money, I will do that, but I don't think that is very likely based on what I've been hearing about this. Here are the fast facts on the different types of plan categories. You're going to have bronze plans, silver plans, and gold plans. So currently I have a silver plan, and that has worked very well for me. I found that that is the best option for me. Bronze is going to be lower monthly premiums than silver, but your deductible is going to be higher, and you're going to have to pay more when you get care. For silver, it's going to be higher monthly premiums, but your deductible is going to be lower, and your plan is going to cover more of your cost. So that is probably the middle plan that most people would want to go with. And then you've got gold, so you've got a higher monthly premium than silver, but your deductible is going to be lower and your plan pays more when you get care. And this plan would probably be the most useful if you anticipate having to go into the hospital or having to have a surgery this year. Alright guys, at this point we're going to be looking at all of the possible plans that I could get, and this is going to be based on my $396 tax credit. So this plan is a plan that I currently have, and this is the Blue Cross Select Silver. So the plan costs $470 a month, but with my tax credit I'm only going to be liable for paying $74.68. So my plan for 2022 has actually gone down from 2021 costs. I was paying about $115 in 2021. So each page here is going to tell you your deductible, your out-of-pocket maximum, and you can add estimated yearly cost. If I have to go to the emergency room, it will be $600. Generic drugs will be $20. A doctor's visit will be $40. A therapy visit will be $40, and those are two things that I use. And then a specialist doctor would be $65. For this plan, Blue Cross actually requires me to get referred out to a specialist before I can see a specialist and have it covered. This does not include adult dental. I actually pay for my dental out of pocket, and it's something that I just prefer to do out of pocket. It's just easier for me. So this is the plan that more than likely I'm going to be sticking with, but let's just kind of take a look just for fun to see what other options there are. So this is the bronze plan, and this would be me downgrading coverage. You could see before that it was $3,700 for my deductible. This one would be a $7,000 deductible, but you can see that I would be paying $0 per month. So if I was, strapped for cash or something like that, and I had to have health insurance, I would be able to get this for free. And I think that that's something that people just aren't educated on. They just aren't aware that these plans exist, and there are a lot of people who just don't plan on signing up for it because they think it's really expensive, and they think, oh, well, you know, my plan was $348, that's what I have to pay. And that's not necessarily true. That doesn't reflect what you will actually have to pay. This is set up to give people healthcare based on what they can afford, and I think it does a pretty good job of that. So I would be able to get healthcare for basically nothing if that was something that I wanted to do this year. So this is going to be a gold plan. This is probably one of the more expensive plans. It says it was $579 per month, but with my tax credit, I would be paying $183 per month. However, my deductible jumps down from $3,700 with the silver plan to $850, and my out-of-pocket maximum here is going to be $6,000. My emergency room costs would be $300, generic drugs go from $20 to $10, and doctor's visits go down to $35. So not a major change here. The only major change that we're really seeing is that deductible gets lowered quite a bit, but our monthly premium goes up. So for those reasons, I'm going to be going back to my plan that I had this past year, and I'm going to be sticking with what works for me because I know that this coverage is good. So now that I have made my decision, and you don't have to make this decision immediately, you can go do some more research, but now that I've made the best decision for me, all I'm going to do here is just click enroll. Alright guys, we are almost done. It says the last thing we have to do to be fully enrolled is to pay my first premium by the plan's due date. So I have already automatically enrolled in AutoDraft to pay my health insurance bill, and I'm already set up with this provider, Blue Cross and Blue Shield of Alabama, but I'm going to just make sure everything is set up properly so that we can finish this out. And you can see that I have recorded this whole video in about 15 minutes, so I think that this is something that, you know, if you want to sit down and plan for about 30 minutes to an hour, this is something that you can definitely do and take a look at. It's not hard to get healthcare in 2022. It is very easy and very simple, and I hope that this video has been helpful for those of you who are wondering about it. Again, guys, this is the website Healthcare.gov, and as you can see, open enrollment is here. Just do it by December 15th for coverage starting for January 1st, 2022. And you can see that I'm going to be paying $75 a month for 12 months, so I'm going to be paying $900 out of pocket for my health insurance in 2022. And if I have to go to the doctor, it'll be $40. And you know, I think reasonably my care for the whole year will probably come down a little bit from last year, and I'll be paying anywhere between $100 to $150 a month if I continue to go to therapy and go to the doctor. So excellent plan, excellent choices here. I hope that you guys can get coverage for 2022, and I hope that you guys have a great year. So take care, guys. Thank you so much for watching the video.